Welcome back. In today's Health Yes with Genesee Health Plan, we're talking about the importance of cancer screenings and preventive services. So joining me now is Linda Hamacher, President Emeritus of Genesee Health Plan and a breast cancer survivor herself. Thank you so much for being here.
Well, thank you for having me.
Absolutely. So, our first question, why are health screenings so important for women? Of course, October being Breast Cancer Awareness Month.
Well, breast cancer is one of those diseases that if it's detected early, you have a much better chance of survival. You have a much better chance of not needing a drastic treatment. And it's just a lifesaver if you can get diagnosed early enough. Breast cancer is going to kill 40,000 women in the United States this year. 1 out of every 8 women. Wow. And it's very important to understand what your risk factors are. If the biggest risk factor is one we can't do anything about, and that is age. 80% of breast cancers happen in women over the age of 50. And so age and family history is another risk factor. Things even like hormone replacement medicine and breast implants can increase your chances of getting breast cancer. So we all need to be aware of what our risk factors are, and the most important thing is to go for screenings and mammograms and to check, self-check for lumps and so forth.
Now, you have personal experience with this.
Yes, I do.
How was yours detected, your breast cancer?
Well, I was supposed to go for a mammogram in May, and there was a lot going on. My husband was sick and so forth. And I didn't go. And like a lot of women, I thought I had a lot more important things to do. Well, in October, my doctor's office called and said, "Your physical's scheduled now. Did you go for your mammogram?" And I said, "No." "Well, you better go." So I did, and there it was. And I can tell you the most terrifying thing. My first thought is, this cannot happen because it doesn't run in my family. I thought that was probably the biggest factor, but it isn't. Yeah, 85% of breast cancers are, happen to women who don't have a family history. Right. So I was shocked, and then my second thought was, what about the other women in my family? What about my mom? What about my sisters? What about my daughter? And it's just that kind of terror and concern that happens. And fortunately, my cancer was caught soon enough that I'm here today.
Yeah, absolutely. And it's important. We have to put ourselves first. It's easy with kids and spouses that we don't always do that, but it's important. Another thing that's important to Genesee Health Plan, prevention.
Absolutely, and not only for breast cancer, but colorectal screenings are so important, blood pressure so important, all of the things, blood glucose levels, all of those things that we hear about that are so important. We need to take care of ourselves. We need to have a primary care physician. That's one of the most important things, is if you have a primary care physician, they're going to make sure that you get your physicals, they're going to make sure that you're getting your blood work and your mammograms, and they're going to help you make sure that you're getting the screenings. Another important thing is that Genesee Health Plan will make sure that you have access to mammograms. Nowadays, it's one of the 10 essential benefits covered through the Affordable Care Act, or Obamacare. So if you have insurance, it's covered. If you have Medicare, Medicaid, regular insurance, mammograms are covered. If you're uninsured, or if you need help accessing it, please call Genesee Health Plan, because they have the breast and cervical cancer control program there, as well as Wise Women, and they can even make arrangements for transportation.
Yeah.
And so it's just very, very important to know that there are a lot of resources in the community.
Wonderful. Linda, thank you so much for being here. Now, if you want more information about today's topic, log on to the TV5 Facebook page right after the news at 9. We will be there live answering your questions.